I'm here today to share a new and stunning revelation unearthed by my staff on the Senate Budget Committee. Part of my responsibilities as the ranking member is to look at the long-term cost of legislation. So we wanted to ascertain the long-term cost of the President's health care bill. I was floored by what we discovered. But first, let's put a little context. President Obama told the American people repeatedly that his health care bill would cost $900 billion over 10 years and that it would not add one dime to the public debt. But we have shown that the cost score for the first 10 years of implementation, when the bill is fully implemented, is actually $2.6 trillion, almost 3 times as much. The more we learn about the bill, the more we discover that it's even more unaffordable than was suspected. So over a period of about 3 months, our staff has worked diligently to estimate the new unfunded liabilities that would be imposed by the passage of this legislation. This is not the total cost of the bill, but the unfunded mandatory coverage obligations incurred by the United States government on behalf of the United States people over a period of time. An unfunded obligation is basically the amount of money we have to spend on a mandatory expense that does not have a funding source. It's money we don't have, but money we're committed to spend. It's this kind of long-term, unfunded obligations that have placed this nation's financial situation at such great risk. So my staff used the models that are used by the Center for Medicare and Medicaid Services. They've talked with these individual experts about these numbers and worked diligently to come up with a figure using appropriate methods. That figure, using the administration's own optimistic assumptions and claims about the cost of the law, is an incredible $17 trillion. At a time when we should be trying, we have to shore up programs that are threatened by default, Medicare, Social Security, Medicaid. This health care law adds an entirely new obligation. Instead of doing something about those programs that are headed to bankruptcy, we add, under this president's determined insistence on a straight party line vote, one of the largest unfunded mandates in history on top of what we already have. How can we possibly justify this? It cannot be justified. This bill has to be removed from the books because we don't have the money. So I'll be sending a letter to the GAO, the Government Accountability Office. They do these kind of scorings over 75 years, and we're going to ask them to construct their independent estimate of the unfunded health care law obligations. I believe they'll be similar to the ones my staff has produced. I hope they're better, but I'm afraid they're not. And even if they come close to what we've calculated, it's pretty clear that the money that will be coming in could be far less, and the obligations could be far more than are being projected.